welcome to Medical Minds, and we are going to look at recurrent miscarriages and pregnancy loss. Let's learn. Doctor, let's go straight into our topic of discussion, recurrent miscarriages.
Yes.
Kindly help us define it so that we understand it better.
Yeah, so there are two things there really. One is a miscarriage.
Okay.
That is the base term, and then recurrent. Now, miscarriage is where a pregnancy loss occurs before the pregnancy reaches an age where the baby could have survived.
Okay.
Yes.
That is at what age?
So usually the age has been going down because of improvement in medical care.
Okay.
Yeah, so now we're down to 22 weeks. One time we used to be around 28 weeks.
That is still the first trimester?
Yes, that is end of second trimester.
Oh, end of second trimester.
Yes, so we used to be at 28 weeks. That is, we were able to sustain a baby only after 28 weeks.
Okay.
But now we are able to sustain up to 22 weeks. This is a big improvement in healthcare.
True.
So that is miscarriage. So if a pregnancy is lost or the baby comes out before the pregnancy is beyond 28 weeks, then that's a miscarriage. Now, if this occurs 2 or more times, it is said to be recurrent.
Oh, recurrent means repeatedly.
Repeated, yes,
okay.
yes.
Oh, thank you.
Initially, the old scholars will be saying, no, it is 3 or more times. No, that has been revised downwards. Because the logic behind there is that when a pregnancy loss has occurred, there's a high chance that a next one could occur. And the reason is that there may be an underlying reason. Yeah, so the idea now is to prevent any recurrence of a pregnancy loss. Yes, so it has been pushed down to twice. And initially we used to talk about one following after the other. That is consecutive. Now we no longer call it consecutive. As long as there are 2 pregnancy losses or more, that is referred as recurrent, because we don't want to lose any pregnancies.
True. Yes, the causes of this recurrent miscarriage, because many mothers are really going through this, especially young mothers, and they seem not to be knowing what could be happening.
Now, coming down to the causes.
The causes, yes.
Yeah, so the causes can be grouped into about 3 groups.
Okay.
There are those causes which are related to diseases in the mother. You know, the mother has a medical condition which affects the pregnancy, and it makes the pregnancy come out. And because the medical condition is not addressed, it's there in the mother's body, and she continues to have that medical condition, and it affects the pregnancy, whichever pregnancy comes in. That is one.
Doctor, before you go to the next one, what could be these medical conditions or infections or diseases that can always disturb mothers?
There are a number of them. Some of them are infections.
Oh, okay.
But
these normal infections?
There are special infections like syphilis. We still do have syphilis in our population. Toxoplasmosis is a parasite infection which comes through doves. But what we see more significantly in conditions which cause clot disorders in the mothers. What we commonly refer to as coagulopathy. Okay, sorry to use a medical term, but it's a disorder of clotting. Blood clot forming abnormally when it's not supposed to be forming, and it forms in the tiny blood vessels in these women. And so
around the uterus, or
so it actually is supposed to be occurring in their body, but when pregnancy comes, now it occurs in the placenta. Yeah, so now imagine it is occurring in the placenta, which does not have the ability to deal with these clots at that time, and so it will block off some of the parts of the placenta, and then it starves the baby at a very early stage, and you find the babies cannot survive. Some of them don't grow very well, so they start losing weight inside, and you find eventually the baby stops breathing. Yeah, so this is one of the things. Those are some of the things.
The diseases.
The diseases in the yes. That's one of them. Yeah. So those are diseases in the mother. Yes, but also there are some local diseases in the womb of the mother. for example, some abnormalities of the womb which the mothers are born with. Yes, so abnormalities of the womb where the mother is born with. There are those conditions where the womb is born and it is divided into two parts.
How is that?
Yes, I mean the woman is born with it because it's
an
abnormality. Yes.
Okay.
So a womb with the curtain inside, if the baby is attached to that sort of septum or curtain, then the pregnancy cannot grow. It will come out early because the blood supply is not enough.
So can such a mother be helped?
Yes, those conditions, when they are identified, they can be corrected. In a very simple way. We can correct them.
Okay.
Yeah. So those are some of the. So even scars of the womb, extreme scarring of the womb, and this is very important to mention because when people have when they're having, for example, the first miscarriage. Yes, then they are treated badly because they go to places where they don't have qualified health workers, and they sort of scrape deeply, and the scraping results into scar.
That is scraping the tubes?
The womb.
The womb.
Yes, when they are cleaning up, they clean up. You know, the clean up looks a simple procedure, but it can destroy the womb. Yeah, so it must be done by
a professional person. Okay.
So if it's not done well, you can get infection, you can get scarring, and eventually then the next pregnancy will be coming out.
out.
Yeah, so those are disorders of the womb. Yeah.
Thank you.
Yeah.